Thank you so much, everyone, for coming. This is the first of our Listen and Learn series. My name is Danielle Lewis. I'm the Health and Communities Officer at Public Health Services. We've got 6 of these sessions, which is really exciting, and each one has a different focus. And our aim for today's session really is to consider solutions for health and wellbeing challenges that are faced by Tasmanians in these COVID times. And we're really looking forward to hearing from our 2 key presenters today and discuss ways that we can and have supported our communities, especially at the moment. I'd like to acknowledge and pay my deep respects to the Palawa people of the South and the Pakana people of the North, who for tens of thousands of years have lived, practiced culture and cared for this country, Lutruwita, Tasmania as many of us know it. I recognise the proven record of Aboriginal community-controlled health organisations in improving the health and wellbeing of Aboriginal people. Aboriginal people's health and wellbeing is improved when people are together on country, sharing culture, stories and creating stronger connections with each other and community. And I continue to have much to learn from the Aboriginal people of Tasmania, and I really look forward to us learning together today and from each other about what's been working in Tasmania to support our community during these troubling COVID times. I'd like to hand over now to Lee Arnold from Lee Arnold Communications. He's going to be facilitating our session today. So welcome everyone, and thank you, Lee.
Our first speaker today is Dr. Lynn Jarvis. Hello, Lynn. Everyone wave to Lynn. Welcome, Lynn. Thank you. Lynn Jarvis, Dr. Lynn Jarvis is the CEO of Working It Out, Tasmania's diverse gender, sex and sexuality support service and education provider. Lynn has worked in a variety of management and executive level positions across government, adult and higher education and the not-for-profit sector. And while a born and bred Tasmanian, Lynn has also lived and worked in Japan, Malaysia and Cambodia. A key theme of Lynn's work is supporting those marginalised from opportunity to live full and inclusive lives in whatever way that means for them. Lynn's focus is on leading from a values-based position and on working towards a more just society for all. Lynn has a BA Honours from the University of Tasmania, a Bachelor of Education from Edith Gowan University, and a Doctorate in Education from the University of Wollongong. Welcome, Lynn.
Hello.
Yes, hello. And so my first question to you today, Lynn, is can you just tell us briefly what project or initiative you're going to be talking to us about today?
So today I'm talking about the Working It Out Together project, which was a COVID specific initiative that we put on, and it is basically a sort of volunteer matching scheme for and by LGBTIQ people. So to be part of the scheme, you needed to live in Tasmania, you needed to be over 18, and you needed to be a member of the LGBTIQ plus community.
Thank you. And can you tell us about how COVID-19 has affected the LGBTIQ plus community in Tasmania and how your organisations responded?
Yeah, so like many minority groups, the impact of things like COVID-19 can be exacerbated. And we were lucky in Tasmania to have some research done very quickly by the University of Tasmania on how the pandemic was impacting. So it's the first research really anywhere in Australia to look at that. And so what we found was that many people had lost connections. Now, sometimes members of the LGBTIQ plus community have fewer places where they can connect safely than might otherwise be the case. And for some people, those dried up really quickly. And so people were starting to feel very isolated. Also, people were feeling quite anxious, not only about themselves, but about other people. And it's got to be remembered that many members of the LGBTIQ plus population have the living memory of a pandemic with the AIDS pandemic, which, you know, killed like 35 million people, which I think sometimes gets forgotten how bad that was. So that also, I think, impacted some people. And we were seeing that also in our own service delivery. So we can map it to the day when COVID started to impact us, and we had a spike in demand for our services, both for our one-to-one support and for our online groups. And so that's what sort of led us to think about, well, how can we respond to that? What can we do to meet those needs?
Yeah, it was really interesting when we spoke before, just to follow up on that question, Liz, when we spoke before, and you mentioned about the loss of safe spaces for people in the LGBTIQ plus community. Can you just explain what you mean by that, and just expand a little bit more on how your organisation has helped to address that particular challenge?
So for not everybody, of course, but for some people that they may have lost family. So it is still unfortunately true that many people lose family when they come out as same-sex attracted or gender diverse. So they have sometimes limited ways to connect with other people. In addition, particularly people in the gender diverse community, it's often that they are subject to discrimination and stigma. And so again, the places where they feel safe and feel that they will be understood without having to explain themselves or justify themselves can often be quite limited. And in addition to that, and I think, you know, while we've had marriage equality and all those things, they're only in the recent past, and many of the older members of the LGBTIQ plus population have a significant history of trauma, stigmatisation and even abuse, which continues to impact them today. And so even if we say some organisations are safe and inclusive, it still doesn't mean that they'll be frightened to access those organisations because of past experiences or fears about what might happen.
I thought, look, thanks so much. As just a reminder to the group, I mean, we are here today to talk about collectively as a group what some of the solutions might be that you might be able to take away with you for your own work in terms of overcoming some of the challenges that our communities and our clients are facing in response to COVID-19. So it's good to focus a little bit on that, and I'll lead on to that with my next question with you, Lynn. But before I do that, just a quick reminder, and if you do have any questions for Lynn, feel free to type them into the chat box as we go, and I'll be able to pull those out and put those to Lynn when I finish speaking with her in a couple of minutes. So my next question, Lynn, is as follows. COVID-19 obviously has been a hugely challenging experience for many people and many organisations, you know, a good number of which, of course, are represented by the people who've turned up and joined us today. But it's also presented great opportunities to innovate, interestingly. So what has working it out done differently? And what lessons have you learned from that since the pandemic started?
Yeah, that's a great question, because it really has been an opportunity for us as an organisation and as a staff. So one of the things that we learned is that you can consult really quickly. So as I said before, we started to hear from our own service users that people were feeling disconnected and isolated. So I did a really quick community consultation, just thought of all the people that I know in community and groups. Mez is here, for example, one of those people, and just put out an email saying, look, this is what we're hearing, this is what you're hearing, we're thinking of doing this project, what do you reckon? And so I got immediate feedback from that. So that was really interesting for me, just to see how quickly we could communicate with a broader community and get feedback on something. The other thing about COVID, of course, it was just such a disruptive time, and it's almost like all being tipped out of our carts and sort of pick ourselves up and dust ourselves off. And as an organisation, that meant we couldn't do some things. And, you know, for a time there, not very long, like a few days maybe, we kind of felt like we were just floating around a bit, not quite sure what to do. And so the opportunity to redirect some of that energy into something positive and new was quite useful. So whilst our service use was increased, some of the other work that we did, particularly around our training and community events and so forth, we weren't able to do. So I redirected staff into the Working It Out Together project to do that, and also put some extra resources in it. And I think it gave us a great sense of energy at that time. The other thing that we did differently is that we decided to advertise more broadly than we would normally. We had a groovy front page stuck on our webpage. It's still there if anybody wants to go and have a look. Won't be there much longer, but we forced people in a way to take notice of this scheme by putting it front place on our website. You have to kind of click out of it if you don't want to look at it. We paid for Google Ads, Facebook posts, and we try to use as many mechanisms, including some old school things like newspapers and just community awareness, networking with our community partners to really get the word out as far and wide as we can. So that was really good. And so what we've found, in fact, is that we've not only had people come into the volunteer scheme, but also we've found a lot of other people who are actually kind of accessing our service through that, and sometimes they need other things. We had quite a number of young people that we weren't going to match up with volunteers, but they've come into our service through that way, and we could direct them into other more appropriate kinds of support. So, I mean, I think that's a really important learning for us about how we engage. The other thing that COVID forced us to do was to interact online to a large extent. We did support some what we called social distance walks and footpath chats, but basically it was an online environment. So that, as we know, has its downsides, but it also has had some advantages. It's created a level of safety, I think, in some respects, that people aren't engaging face to face. And it's also meant that we could reach other parts of the state that we typically can't always reach because we don't have enough resources. So we've found the reach of working it out together to be across the state, and we could match people up from Burnie who live with somebody who's in Dover. Distance in that online environment doesn't really matter so much.
So what was it about the circumstances in relation to COVID-19 that allowed you to do all of that stuff that you couldn't do under normal circumstances?
Well, I think it's motivation is part of it, and need. You know, suddenly you're confronted with an emergency, and we often respond well in emergencies. Again, secondly, it was the ability to redirect some resources away from what we do normally. I think the disruption of COVID as well. So for us as a staff, we were kind of thinking, we were hearing stuff and we wanted to do something, but it was just we had to put our heads together and think, well, what could we do? What was reasonable in this circumstances? So the impetus to think outside our normal box, I think, was driven by the sort of really unusual circumstances that we were in.
Yeah, great. So this is my final question coming up here. So if anyone wants to get ahead of the queue and ask a question, now's a good time to pop it into the chat box before we turn to the group for some questions for Lynn in a moment. My question is as follows. Helping our clients and communities seems to benefit the actual people who work in the sector as well. So obviously the clients and the communities, but also the people who work in the sector as well. Again, many of whom are in the Zoom meeting with us today. So as people who work in the sector, why is it important for us to put energy into taking action around COVID-19?
Yeah, I think it would have been easy to do sort of nothing. And then, you know, a couple of weeks in, I was thinking, what the hell was I thinking? Why did I do this? It was like, it was a big job to do really quickly. But nonetheless, it really provided the organisation with a great sense of energy at that time. And even though we were working remotely, we were connecting and sparking ideas and working really collaboratively. So I think that was fantastic for the organisation. That sense, I mean, we often work in these sectors because we want to make a difference. And so the sense that you could make a difference, even if it was a small one, help alleviate some of that anxiety was really important. And one of the things I said first up, because we had no idea what the response would be, I said, well, maybe we'll get nobody, but the fact that we're there will alleviate the anxiety of some people who are worrying about other people. So, you know, so that was really important too, that even if it didn't prove to be that successful, having a visual presence of saying we're doing something, that we're thinking about you, that we care about you, I think was really important to me personally and to the staff. And I think is something we're really proud of. We've learned lots from it too, you know, so again, when you do things really quickly, you learn and you adapt. And so we've got lots of lessons to take away from that experience.
That's great. Look, we've got a few questions coming in now, so I might pop the first one over to you, which is from Michelle Thelberg. I hope I pronounced that correctly. And if I haven't, you can unmute yourself and tell me how to do it properly. So from Michelle, the question is, as well as complimenting your website, by the way, Michelle thinks that looks great. Her question is, have you seen an increase in alcohol and other drug use amongst the community during COVID-19, amongst your community in particular?
So look, as a general rule, the alcohol and drug use amongst the LGBTIQ plus population is higher than the national average, but it's not something that we particularly collect information on. And some of our support workers might be able to tell me that information, but I don't have it off the top of my head. But but you know, as I said, these kind of events tend to exacerbate existing problems, so I would expect that there would be some exacerbation of that existing higher than average level of alcohol and drug use amongst the community.
And a question now from Rebecca Essex. And what areas of focus of the innovation are working out planning to keep or change in the short-term future? So what innovation?
Yeah, that's an interesting one. So one of the things I have said all along, that this is a COVID-specific initiative and really to go principally to the end of September. So I didn't want to get anybody's hopes up, but it is something that we would like to try and continue. So unfortunately, some of the resources that we were able to put to COVID, that the Working It Out Together initiative, now have to go to other things. It's now that we've sort of back to some of our more usual work. So for us, it's about if and how we can continue the project. I would like to see if I could expand it into a broader LGBTIQ plus volunteer kind of buddy scheme, but that's just a little bit down the track. So the plan for the moment is to sort of see if we can keep it ticking over, perhaps take it off the front of our website so it's not quite so obvious. We won't promote it as much. We'll definitely support the people that are already in it, and then look for ways in the next 6 months to see whether we can continue and even expand the project. Can't hear.
Yeah. Oh, that's this is the universal symbol, by the way, apparently, for you're on mute. So some people do that. That looks kind of good too. It feels a bit aggressive to me, but like that one's pretty good. So if if anyone's talking at some point and they're on mute, feel free to give it the big earphones gesture. It always looks hilarious when everyone does it at the same time as well. Question here from Georgie Crockett. What will you continue to do beyond COVID? Will your learnings change your business model? So a little bit similar to before, but particularly that question there about will it change your business models?
Yeah, so I mean, there's a couple of things I hadn't spoken about, but one of the aims of the Working It Out Together was really to make sure that if we had people come in as participants, not only would they be matched with a volunteer, but that we would try to connect them into other community groups, of which there's quite a number around Tasmania, so that if and when we're not there, then those people are connected out. And also we put together a list of LGBTIQ plus friendly and wherever possible Tasmanian events and groups. So people had a one-stop place that they could go and look for all that information. So often we hear, oh, I don't know how to connect. I had somebody come into my office last week and said, I've been in Tasmania for 6 months and I've not met another queer person. And I said, oh, you've come to the right place. And I promptly took off to a social gathering that I myself was going to that night, which was perfect for what they were looking for. So there are lots of things happening, but sometimes finding them can be difficult. So we'll try to keep that going as well. The other thing that we'll continue with is some of our online delivery, particularly around our groups and our support sessions. And I think probably some of the online aspects of our volunteer program, I think they've been important in allowing people to establish a bit of a relationship first before sort of perhaps meeting face to face. So that will probably continue as well.
Fantastic. That's some really nice segue into the next question from Rachel Cuthbert, which is, bear with me 1 second. Where's it gone there? There it is. Have you discovered any innovative ways to upskill people who are not very tech savvy? Obviously a really important question at this time, and here we are meeting with tech. So have you found any innovative ways to upskill people in your communities, or indeed maybe your staff who are not tech savvy?
We have been using most of these technologies already, so as a staff we were okay. We did put together some resources for how people could access technology, online technology, and the Australian government actually put out quite an amount of information, particularly for older users of IT. So we pointed people in that direction. But if people weren't comfortable with IT, they didn't have to go online. We could do phone, and we also mailed some stuff out to people. So we didn't want to limit people just to sort of Zoom or Teams or whatever people were going to use, Skype. A lot of people just connected up by phones or even text messages. And so at least down to phone level, there's not many people that you can't communicate with by phone. So I think one of the things was just make sure that we had a broad range of possibilities, different ways. The other thing that we did is we collected information from people, both participants and volunteers, about what level of technology they were comfortable with. So we didn't try to match somebody who was a whiz, bang, I want to do everything on Zoom, with somebody who just wants to do a telephone. So we try to match that up along with other things that were important to those people.
Brilliant, great, thanks everyone. That's good, isn't it? It's definitely a risk that you run with Zoom. I've got a question that's come in from Joanne, and I'm just wondering if Joanne, if you're there. I'm just looking across the many screens for me. If you would like to, hi Joanne, there you are. I'm just wondering if you would like to unmute and ask that question yourself.
Yeah. Were there any gaps that you encounter?
What kind of gaps do you mean, Joanne?
Any challenges?
Not to date. One challenge is that, well, not exactly a challenge, but we have more people sign up as volunteers than participants. So it's always a bit challenging to make people feel that they're contributing when they're not actively doing a volunteer role. So we've tried to keep in touch with our volunteers through regular emails and just say, look, thank you for being there. We really needed more participants and volunteers so that we could kind of match people's various situations and interests together. So that's been a challenge. Other than that, fingers crossed, it's gone remarkably smoothly. We did insist that everybody, I suppose another challenge was that we did insist everybody have a Working with Vulnerable People card to be part of the scheme, volunteers, sorry. And so sometimes there was a lag between the time it took for them to get that card. So sometimes we had people that we thought, oh, well, that'd be great, they'd work with that person really well, but we had to wait several weeks because the volunteer didn't have a Working with Vulnerable People's card yet. Interestingly, some people swapped from being volunteers to participants, and we always said that was possible, or you could be both. So that was an interesting outcome too, where some people just worked through and figured out they'd be better off being a volunteer, or vice versa, that they were actually probably better suited to be a participant, somebody receiving support from a volunteer.
Thank you.
Look, yes, and thank you, Joanna, for the question. Lynn, that's terrific. That's 20 minutes. That went pretty quick. And if people do still have questions for Lynn, feel free to still pop them in chat for the remainder of today's session, and we will put them to Lynn and make sure that you get those responses by email. So even if, say in about 5 or 10 minutes, you come up with a question that you wish you'd asked, just pop it into chat, make it clear that it's for Lynn, and we will put that to her and get you a response. So Lynn, thank you so much for being with us today and for sharing your thoughts. Please stick around for the rest of the session, and if you're able to, we'd really love to hear more from you before the day is done, including through the group work. But I would like to move on. Yes, thank you. I would like to move on now to our second speaker today, is Liz Mankin, Public Health Services Priority Populations Officer with the Department of Health. Liz has been working in health-related community roles since arriving in Tasmania 20 years ago. During that time, she's worked on a broad range of health promotion and community development projects where she's made lots of mistakes, and learned many valuable lessons, which makes her perfect for today's session. And she lives on a small farm in North Lilydale with her husband and 2 children, where they raise Angus cows and apparently dream of planting a chestnut orchard. Now, when Liz told me that she was dreaming of planting a chestnut orchard, that immediately piqued my interest. So I emailed her and said, why are you planning to plant a chestnut orchard? And it turns out it's got very little to do with chestnuts and more about having somewhere to have a picnic and drink Pinot. So good on you, Liz. That sounds like a really nice thing, to do. Let's move on to some questions now, if you don't mind. So if you could pop yourself off mute, and we'll get into it. First question for you, Liz, is can you just explain to the group briefly what project or initiative you're going to be telling us about today?
Surely. So today I'm going to talk to you about the Migrant Support Network that was set up in response to the outbreak of COVID-19 in Tasmania. I've been lying in bed all night trying to work out how to make that sound innovative or even interesting. But when I started thinking about the outcomes from that, I got really excited. So stay with me. So the network, we learned really early on from the meningococcal experience that we had in 2018 that we actually weren't really well prepared to support migrants, or particularly people who weren't able to or familiar with English in a written or spoken format so much, and we had a way to go to be a bit more prepared. So when COVID hit, we knew we needed to get going pretty quickly and get something organised. So we convened with our contacts at Public Health, and Communities Tas had a bunch of contacts as well, and we quickly kind of got together and said, do you want to meet? And we'll just quickly do a Zoom meeting, and we put the word out, and a few of us met from across the sector. So we invited everyone we kind of knew in the sector, and we quickly were able to get a whole range of people from across all levels of government. And those people were the right people to have in the room, people who had some influence and some decision-making capacity, and some resources as well. And we also had in that a direct link to the State Control Centre. So we were able to feed up very quickly some of the issues that we were hearing about. And we were hearing about those issues with the representatives from the communities sector, who were working largely to support migrants, either who've, in all of the visa categories, if you like. So people working in emerging communities through the, largely people arriving through the humanitarian settlement program. But we had tourists, you had family members of people here just on holidays that were on temporary visas, seasonal workers, students, and other people on temporary visa holders. And also anyone who's lived here any length of time who has not a great understanding of written or spoken English as well. So they were the people that we were wanting to make sure we're connecting with and supporting with those key messages from public health, which were changing rapidly. So it was about us understanding what was needed from that section of the community, and how we needed to respond, and in what way from a government and a supporting organisation level. Yeah.
Look, and that certainly sounds like a very interesting project and a body of work to me, and I'm sure to many other people in the group as well. And as we go through these, my quick conversation with Liz, as I say again, if you have any questions for Liz about this very interesting topic, pop your questions into chat. My next question for you, Liz, is, look, it's not going to come as any surprise to anyone that's at this session today that working in partnerships and working in a network is an important thing to do. And I know that it's particularly important to you as well. What I'm interested to know is why you think we should work in partnerships at this time in particular.
Yeah, I think in this, with COVID in particular, we really needed that symbiotic relationship where we were able to connect directly with communities and the issues that were being experienced. I think I know that we can't know everything about everything from my position in public health, and we can't do everything. So we have a particular role to play, and with a particular set of skills and resources. but they're only amplified when we work together with other people across the sector. So for us, it was working with people like the Migrant Resource Centre, the Red Cross Bicultural Health Program, Department of Education EAL project, those organisations that were working on the ground with real people, if you like, who were able to say to us, look, that's not going to work if you just translate information and put it on the website. People aren't going to the website to look for information. We had a lot of knowledge around what the evidence tells us about general literacy in Tasmania anyway, for written resources, but knowing that a lot of people who have come through, particularly on the humanitarian settlement program, and spent potentially a decade or more in refugee camps and haven't had opportunity for schooling, their ability to access resources in their own language is sometimes limited as well. So we had to learn what it was that we could do to effectively communicate some of those key messages. And all of us, even English-speaking people, were finding it hard to catch up and to keep up to date with how many people you could have in your house and how far away and could you go shopping and all sorts of things. So when it came to issues like troops hitting the ground in the northwest, for people who've gone through a refugee situation and potentially have negative experiences with military, then that could be incredibly traumatic to not understand what that was. So our challenge was to get that information to people in as fast as possible, to reassure them that if they did see anyone in uniform, to not be concerned that it was about our protection. So there are many reasons that we needed to work collaboratively with other organisations.
Great, thanks, Liz. I know that you don't like it when people describe, when clients are described as hard to reach. Why is that?
Well, for me, that's the sector equivalent of fingernails down the chalkboard. I hate it. It's just one of those back office terms that we kind of use, and sometimes it makes its way to sort of front office language. And I think that it's kind of a cop out. It's often that we haven't got the skills or the appropriate ways of connecting with people. I've heard them, it's referred to as the people who are least consulted, which is probably another way of better describing the people. I'm sure that when we talk about migrants in Tasmania, I mean, they're sitting there, they're well connected, they're very skilled at getting information in different formats and then sharing information quite easily. It's just that we don't tap into some of those things, those ways that people communicate. So one of the things that we found through working in the network is obviously written materials aren't always useful, translated written materials. And also it takes I don't know if you've ever had anything translated, but it takes a long time. And in Tassie, that all gets done largely on the mainland. So in COVID, every NAATI accredited translator was flat out doing stuff for governments across Australia. So it was quite a long turnaround time. And then you've got to get it all approved through government processes and stuff. So what we found, because that wasn't necessarily the best way to communicate with people, was we would take the media briefing notes from the Premier's daily media briefings, which had all the key things in it, what to do, where to go, who to see, that sort of stuff, when to get tested. And then we sent that through in a really short dot point format in plain language English to our bicultural health workers at the Red Cross, or the Red Cross's bicultural health workers. And they determined what was the best way to get that out to their communities. So they're native speaking in those communities. So what they did was actually do an audio record. They translated it, audio recorded it, sent it on WhatsApp or whatever social media platform was largely used in that community to send community messaging around, and it would go very rapidly. And so on the same day that everybody else got the information, people who weren't speaking English or watching those communications were also receiving that key information as well. So it was a really good time saver. And you know, Lynn mentioned earlier about distance being something that we're able to kind of get over in this sort of format. It was the same with messaging. One of our bicultural health workers was actually on holidays in Ethiopia So the messages were going to her. She was recording them in Ethiopia in 3 languages and then sending them back via WhatsApp. So it was really quite an innovative way of getting messages to communities really quickly, in a language and in a method that they were using and was really effective. So yeah, did I answer your question? Yeah, so they're not hard to reach.
Yes, thank you, Liz. And look, and that's a really great practical solution there for a problem of reaching people who are sometimes described as hard to reach, by taking those daily briefings and then circulating it and translating it in the way that you've just described. And for the other people on the session today, that may have sparked a thought in your own mind about some of the practical solutions that you've come up with in your work over the last few months. And if it has, hold that thought in your mind, because that may be useful in the section that we're about to come to shortly. So now turning to some questions. No one has yet popped a question into chat. So what I might do, there goes Jodie, bless you Jodie. What I might do is open the floor up. Oh no, sorry, there's a message there from Jodie saying, I'm sorry, but she needs to leave. So other Judies, that's totally understandable. Thank you for joining us, Jodie. If anyone has a question that they would like to put to Liz, I'll just invite you to unmute yourself and ask it with your actual voice.
Elise, Lynn here. I'm sorry, I'm on an iPad, so typing a question is a bit awkward. I'm just interested with Liz whether the lessons of the value of that communicating with communities so quickly and will be sort of incorporated into the work going on the future. I mean, I know government's sort of moving, I think, slowly in that direction of getting input from communities, but I wonder if this might speed it up a bit.
Getting input from communities. Did I understand that correctly? Can you hear me?
Yeah.
Sorry, I can't hear.
Yeah, Liz is just
sorry.
clarifying the question there, I think.
Is am I understanding correctly that is that speeding up input from communities by having that?
Yeah. Yes.
Yeah.
Yeah. So whether the ramifications are broader, I guess, than just COVID-19.
Yeah, absolutely. So it was actually delivering audio, public health messages through audio on audio format was something that we were exploring anyway. And we were actually working on a project. We'd translated, we'd recorded, we'd had it all ready to go, and then COVID hit, so we had to shelve that and then get onto the other stuff. But actually, what it was that concept that we applied straight away, and it was sort of like the proof of concept. And we proved it worked. So, well, it proved itself. So I think what that's done is given us confidence to go back to those resources, get them out there, and particularly for our relationship with Red Cross, because we have a funding agreement relationship with the Bicultural Health Program. So we've been talking about, they talked about how that's pivoted some of the things that they do in their service delivery. And as we're talking about other things that we're coming into, heat health, and sort of fire risk, smoke, as we're coming into the season, bushfire risk, those public health messages will absolutely be looking at delivering in a different format and providing those in audio. And given the literacy levels of general literacy, we'll also be providing it in an English format as well. A lot of migrants will speak English, but they won't read it. So that's a consideration there as well. But what the network has done, I guess, for us is there wasn't a network that was that broad that existed in Tasmania prior to COVID. So we have connected in a really meaningful way as a sector, and we have the thing that I think has been really beneficial for us as a whole is that when an issue is raised, people now know who it is that they need to talk to about that. So is it Department of Home Affairs? Is it someone in State Growth? Is it someone in the State Control Centre? Or is it something that can be done between organisations? So I'm seeing quite a nice connection of people that may or may not have been there before, but I think to that level. So the idea of us working as a network will continue on into the future. Yeah.
Right, thank you.
Great, thank you, Liz. Does anyone else have a question that they'd like to unmute and put to our panelists today?
It's Eamon here. I was just wondering, Liz, if I could ask about, I certainly can see the benefits of the collaboration that you referred to in your presentation and the questions that Liz asked. Did that extend to accessing support, resources, perhaps emergency relief with building some of those collaborative relationships?
Directly. Thank you for the question, because that's exactly what happened. I think that was around about $3 million for temporary visa holders that the state government contributed. And I can't tell you absolutely for sure, but that the information that was collected by our the engagement officer at the State Control Centre was taking those issues up to be considered. Yeah, and sometimes in real time as we were having our meetings, she was giving information back to us. So that's it ties into having the right people in the network. So it was more than, and not to be disrespectful at all to anyone who's sort of got a general interest, but we needed to have those people in the room so that when it came to advocating for some support and emergency relief programs, that was absolutely what we were looking to do to achieve.
Perfect storm in a way. Yeah.
And we were able to, I don't have the figures in front of me, but through that, I know that there was additional support to fly people home, people who wanted to choose to go home. There was a lot of work done in that area. And so that was sort of facilitated as well through the network. So it was a very practical purpose of coming together. Yep.
Yeah, I've seen that in a number of sectors, and I'm living in Melbourne, but I've certainly seen it here in terms of some of the support that's come very willingly from diverse elements of the sector, and from people wanting to donate and support people. So I think it's created a lot of visibility for both people who are impoverished, but also refugees, asylum seekers, and migrants as well. Yeah.
I think that I wonder if it's actually because COVID was so unusual and it's taken everybody surprised and no one's an expert. I wonder if next time people that might be a little bit different and people might not be as open to connecting because we're a little bit more informed and kind of know what we should do. I think maybe that might have been the power of us kind of going, we don't know what to do. Let's just get together and talk about it and openness. So it'll be interesting to see how that transpires.
I think so, and I think as well it's interesting how in most jurisdictions, in most countries, the higher rates are in people in low employment, people who don't have regular work, people who are unemployed, and other disadvantaged groups, and it's certainly been the case in this country as well. Yeah.
So thanks very much, Eamon, for your question there. And I think I heard you saying that you're in Melbourne there. And if that's correct, then I'm sure everyone who's on this call from Tasmania sends you and everyone else in Victoria the best wishes. Because
thank you. Yeah, I actually work usually in Tasmania and in Victoria, but unfortunately I'm quite restricted at the moment. But I'm looking forward to getting over to your beautiful state very soon, hopefully in 2021.
Fantastic. We'll look forward to that. I do have one more question, which I want to put real quick from Suzanne, who's particularly interested in the issue of networks. Has actually managed to type out 3 questions whilst we've been waiting there. So I'm going to give you the choice of asking that question yourself, Suzanne, or I can summarize it for you if you'd like me to. Me. Okay, cool. So the question is, it's around networks. Are local government included in the network? And how does the network relate with other networks that are happening at the more regional and local level, and those being migrant networks? And P.S. I love the idea of really quickly produced audio messages sent through WhatsApp. So a little bit more about this network. Does it include local government? How does it work at a regional and local level, particularly with a focus on migrants? And if you want to say anything really quickly about some suggestion around WhatsApp as a device, then feel free to do that before we move on to the next section.
Sure, okay. So yes, local government was on there. And that varied. So because it was quite organically grown, the network, we didn't actually officially invite people to be on the network. We kind of relied on people to spread the news, if you like. But we did have Hobart City Council, Glenorchy City Council, Launceston City Council, Devonport, Cradle Coast, and I'm not sure if there are a few others. So we certainly did have local council membership, and in relation to other networks, we more or less linked in with the TASCOS process of capturing issues that was feeding the PESRAC reporting process. But in terms of the emergency response, there was probably we're relying on our local government reps, I guess, to tap in what we were talking about and bring any issues from a local level. Mostly we were focused on Launceston and Hobart and the Northwest when we had that outbreak there as well. So yeah, they were, it was really kind of up to members to take what we did in that meeting and do something with it. And sort of, yeah, so we haven't heard anything in particular about how that linked in at a local level.
Thanks, Liz.
And in terms of WhatsApp, sorry, go ahead.
I was just going to say, actually, just with an eye on the time, we've only got 33 minutes left. I'm going to invite you, Suzanne, actually to hold your idea about the WhatsApp initiative and maybe bring that into the discussion which we're about to go on to, because that may be Thank you, everyone. I'm just going to, did you hear any of that, or was I just talking to myself? Great, okay. I was just going to say, I'm just going to invite you, Suzanne, to hold that thought of yours about the WhatsApp tactic and maybe take that into the discussion that we're about to have. Just because...
A comment more so than a question.
Okay, great. But it might be useful nevertheless in the section that we're about to have. Which is, so first of all, thank you, Liz. That was great, some really wonderful insights there. Really appreciate you making the time for us today. And so I'd like us all now to quickly wave at Fiona. Hello, Fiona. Hooray! Now, I'm going to hand over to you, Fiona, for a couple of minutes, and you can just talk us through quickly what you've come up with, which I'm certainly very excited to see.
Thank you very much, everybody. If you put your Zoom onto speaker view, you'll get to see the whole screen. And while I'm talking, you'll just get to see what I've come up with today.
Wow.
So part of this is we started this as pieces of the puzzle and putting it together. So we're keeping that theme of the puzzle. But we've all come in today to connect. And I think that was the first thing I heard this morning was we all wanted connection. So we've all come in here to connection. And we had two conversations, so I've mirrored the board today a little bit. And Lynn's conversation here and some of the gold that came out of here. And I think what two main things from here was be visible. So the visibility needed for people to come into the services was really, really important. But also to have that empathetic ear as well, to listen, be available and online. That was really, really important as well for those connections and that quick response to using a whole lot of different resources, but moving things online really quickly. Of course, then we had Liz, and I loved that these key messages that were needed to be delivered and how they were to be delivered really, really needed to be that visual and that quick response thing.
Nice.
And I have worked before in refugee spaces on the mainland, and I understand translation. We had someone once try and translate 5 lines into a Somali language, and it was a page of documents. So understanding that language is really important, but also that response to trauma that really people are seeing as well. So especially the military. And then how did that happen across Tasmania? How did all that information get out there? So through all of those different agencies that had to be connected in, all these different platforms here, so all of those things. And then all down here, I love that someone was overseas and was actually recording, you know, and sending that video messages. That's fantastic. And I just want to, that across both the conversations today, I've just put some keys there that if we're going to network, we have to be able to respond, deliver, and have that translation available. We need to think about that in front of mind. We really need to think about that more. And we need to cut out a lot of that paperwork and heavy language that we tend to use. And what we think about during COVID, this is what we had to the solutions. We faced isolation, mental health, how we disseminate the information, how we make people safe, and how did we practically do that? So we had to make sure they were practical. And of course, down here, the biggest thing that underpins any conversation for me is asking the right questions instead of presuming. We did have Lee up here doing our little intro today. So there's a tiger and some clapping and our welcome. So yes, we're all in there. But thank you for having me do this today. And it's really, really, I love the work you're doing and I love these conversations. So thank you.